Hi, my name is Nicholas Ortiz, and I'm going to be talking about Adderall XR, or its generic name, dextroamphetamine. By increasing chemical. So what is Adderall? Well, Adderall contains extended release forms of dextroamphetamine. So what is Adderall? Well, Adderall contains extended release forms of dextroamphetamine and amphetamine salts, which are stimulants. And that's where XR comes from, and Adderall XR. It's short for extended release. So Adderall is a Schedule II drug, which means it has a high potential for abuse. It's typically prescribed to treat children and adults with ADHD and or narcolepsy. And it kind of works by increasing chemicals in the brain that makes your central nervous system more active. And when this happens, it increases a person's ability to pay attention, stay focused on activity, and control behavior problems. And this is why most college kids refer to it as a study drug, because they take it so they could pay attention on classes, and it lasts about 10 hours due to the extended release forms. And I provided a picture on the bottom left-hand screen. As you can see, just like any medication, Adderall does come with side effects. Some short-term side effects that you could notice right away, usually but an hour or two after taking the prescribed medication, is insomnia, appetite suppression, dry mouth, headache, diarrhea, dizziness, stomach pain, coldness in toes and fingers, nervousness, sexual dysfunction, anxiety, outbursts of words or sounds. And this So there are some health risks that come with Adderall. Some psychological health risks are hallucinations, thoughts of suicide, anxiety, sexual dysfunction, mood swings, depressions, panic attacks, and psychosis. And there are also some physical health risks as well, like hypertension, rise in blood pressure, heart rate, and body temperature, insomnia, weight loss due to appetite suppression, heart attack, stroke, seizures, and kidney problems are just some of the many health risks that come with Adderall, especially if you take them long periods of time without any breaks in between. So according to the FDA, there are some consequences of abuse of Adderall. A person will build intolerance, have extreme psychological dependency, and sometimes severe social disability have occur. A sudden stop and irregular high-dose administration of Adderall results in extreme fatigue and mental depression. Changes are also noted on the sleep EEG, and manifestation of chronic intoxications with Adderall may include severe demetrose-marked insomnia, irritability, hyperactivity, and personality changes. And the most severe manifestations of chronic intoxication is psychosis, often clinically indistinguishable from schizophrenia. Addiction. With long-term use of Adderall, addiction may occur. First is the cravings. So the energy and high Adderall gives individual is so pleasurable, cravings increase until you can't go without it. Meaning that without Adderall, there's a dullness to the world, and addicts will do anything to achieve that high that the Adderall gives them. Next is tolerance. So when tolerance builds up, the user tends to increase their dosage to achieve their desired high, which can lead to an overdose and addiction. And the cycle just continues, because the more they take it, the more tolerance they build and have to take more and more. When tolerance builds, it is synonymous with chemical dependency. This is when your mind and body is convinced that you need Adderall to survive. For most addicts, the only way out is drug treatment. When your body depends on Adderall and you stop suddenly, it can cause severe withdrawal symptoms like headaches or mild anxiety. Then symptoms will increase into depression, suicidal thoughts, aggression, intense pain, and nausea. Thank you. And if you're struggling with addiction, there is a 24-hour hotline. It is 1-800-662-4357. Again, it's 1-800-662-4357. And these are just my references. Thank you for watching.